Hi, I'm Dr. Aparna Tripathi. Today we are going to discuss the oral surgery MCQ related to exodontia. So let's start. Question number 1. The most common instrument used for extraction of a maxillary tooth is option A. Mandibular molar forceps, option B. Maxillary universal forceps, option C. Cow horn forceps, option D. Cryer elevator. And the correct answer is maxillary universal forceps. That is the option B. Explanation. Maxillary universal forceps are commonly used for extraction of many maxillary teeth. The design permits adequate adaptation to the tooth and controlled delivery. Moving to the next question. Next question is, which movement is primarily used during extraction of maxillary first molar? Option A, pure rotational movement. Option B, buccal and palatal movement. Option C, mesial and distal movement. Option D, no movement, only traction is used. And the correct answer is it's buccal and palatal movement. Explanation is maxillary molars have multiple roots. Controlled buccal and palatal movements are preferred rather than forceful rotation. Next question. Moving to the next question. Which elevator is commonly used to remove a fractured root fragment from a socket? Option A, Cryer elevator. Option B, Warwick-James elevator. Option C, Copeland elevator. Option D, periosteal elevator. And the correct answer is Cryer elevator. The Cryer elevator has a triangular working and is particularly useful for engaging and removing fractured roots, especially when space is available beside the fragment. Okay. And the next question, that is question number 4, is the ideal position of a dental chair for extraction of mandibular tooth generally provides. क्या होगी एक्सट्रक्शन ऑफ मैंडिबुलर मोलर के लिए मैंडिबुलर टूथ के लिए आइडियल पोजीशन? ऑप्शन ए ऑक्लूसल प्लेन पैरेलल टू द फ्लोर. ऑप्शन बी पेशेंट्स हेड बिलो द ऑपरेटर्स elbow. Option C, good visibility and access with appropriate head support. Option D, the patient completely upright in every case. So, any guess? The correct answer will be occlusal plane parallel to the floor. And the correct answer is good visibility and access with appropriate head support. Explanation. Proper chair and head positioning improves visibility, access, operator ergonomics and control during exodontia. The exact position varies with the tooth and the operator. Next question. Question 5. Which of the following is a contraindication to routine dental extraction that requires medical evaluation and management? Option A, mild plaque accumulation. Option B, uncontrolled systemic disease. Option C, a vital tooth. Option D, localized caries. And the correct answer is uncontrolled systemic disease. Uncontrolled systemic conditions can significantly increase procedural risk. The patient's medical status should be assessed and stabilized or appropriately managed before elective extraction. Next question. Question 6. What is the main purpose of syndesmotomy before forceps extraction? Option A, to increase tooth color. Option B, to sever gingival and periodontal fiber attachments around the tooth. Option C, to anesthetize the pulp. Option D, to remove calculus. And the correct answer is to sever gingival and periodontal fiber attachments around the tooth. Explanation. Syndesmotomy releases soft tissue attachment around the cervical portion of the tooth, facilitating forceps placement and reducing unnecessary tissue tearing. Next question, question 7. Which complication is most commonly associated with excessive apical pressure during extraction? Option A, root fracture. Option B, enamel hypoplasia. Option C, dental fluorosis. Option D, pulp calcification. And the correct answer is root fracture. Explanation. Excessively or poorly controlled force can fracture the crown or root. Appropriate instrument selection, controlled force and adequate visualization help reduce the risk. Next question, question 8. A tooth with a long conical single root is generally most amenable to option A, controlled rotational movement, option B, only buccal movement, option C, only palatal movement, option D, no luxation before extraction. And the correct answer is controlled rotational movement. Explanation. A relatively straight conical single root may permit controlled rotation because the periodontal ligament and root shape allow the tooth to rotate within the socket. Next question, question 9. Which of the following is the preferred immediate management of a small piece of root displaced into the maxillary sinus? Option A, blindly push it deeper into the sinus. Option B, ignore it in every case. Option C, assess the situation and refer or manage appropriately depending on size and symptoms. Option D, apply forceps repeatedly without visualization. And the correct answer is option C, assess the situation and refer or manage appropriately depending on size and symptoms. Explanation. A displaced root fragment in the maxillary sinus requires careful assessment. Further, blind instrumentation can cause additional injury. Management depends on fragment size, location, infection risk, and symptoms. Next question, and that is the last question. Question number 10. Which post-extraction instruction is most important for maintaining the blood clot during the first 24 hours? Option A, vigorous mouth rinsing. Option B, frequent spitting. Option C, avoid disturbing the socket and follow pressure gauge instructions. Option D, scrub the socket with a toothbrush. And the correct answer is C, that is avoid disturbing the socket and follow pressure gauge instructions. Explanation. The initial blood clot is essential for healing. Patients should avoid vigorous rinsing, spitting, smoking and mechanical disturbance of the socket during the early healing period. So that's all for today. In next class we will discuss another topic with full explanation. So keep watching it. Bye. Thanks.